Hold up one of your hands right now and look at your fingernails. Not a quick glance, a real look. Because what I am about to tell you is something most people over 60 have never heard from their doctor. And it could save your life before a single chest pain ever hits. Your fingernails are recording what your heart is doing. They have been doing it every single day, silently, for your entire life. Cardiologists use this information constantly, but almost none of them explain it to the person sitting across from them in the exam room. And that gap between what medicine knows and what you have been told is where people get hurt. Today I am going to walk you through 7 specific nail signs that can warn you about a cardiovascular crisis before it ever happens. I am Dr. William Carter. I have spent most of my career in preventive cardiovascular care for adults over 60, and I have seen the same thing happen again and again. People come in after a heart attack or a stroke. I examined them closely, and the warning signs were already there, written on their fingernails, sometimes for months or even years before the event. Nobody noticed, nobody told them what to look for. That ends right now, and I need you to stay with me until the very end, because the last sign I cover is the one that shocks people the most, and it comes with a simple self-test you can do at home tonight, using nothing but your own hands. Now, everything I share today is general health education, grounded in published cardiovascular research. It is here to help you notice things and have better conversations with your own doctor. It is not a replacement for professional medical advice. Every study I reference is available in the description below. Before we begin, I want you to do something in the comments right now. Tell me your age, and tell me whether anyone in your family has ever had a heart attack or a stroke. Your answer will determine how seriously you need to take every single thing we are about to cover. And if this kind of content matters to you, tap the like button right now, because it genuinely helps this video reach more people who need it. Now let me explain why your nails carry this information in the first place. Because once you understand the biology, every sign I show you will make immediate sense. Your nails grow from a structure called the nail matrix, a small cluster of cells sitting just beneath the base of each nail. Those cells are in direct, constant contact with your bloodstream. They are nourished by the tiniest blood vessels in your entire body, the capillaries that run beneath your nail bed. And because those vessels are so incredibly small, they are among the very first structures to show stress when your cardiovascular system starts to struggle. Think of your nails as a live monitor your body has been running quietly in the background every single day of your life. After 60, this matters even more. In your 30s, your heart can quietly compensate for dysfunction for years, and nothing visible happens. But after 60, those reserves are thinner. The warning signals start appearing sooner, and your nails are often where they show up first. The problem is that a typical 15-minute doctor visit cannot cover everything. A nail examination rarely makes the priority list. So the information exists in the medical literature. It just never reaches the person sitting at home who actually needs it. That is the gap I want to close for you today. Let us begin. Sign number 1, Terry's nails. The first sign is called Terry's nails. This is not a term most people have ever heard, but once you know it, you will look at every pair of hands differently for the rest of your life. Terry's nails happen when the entire surface of the nail turns an opaque, whitish or very pale color, almost like frosted glass, with one defining feature at the very tip. There is a narrow strip of pink or reddish color at the far edge of the nail, usually just a few millimeters wide. That strip at the tip is the key marker that separates Terry's nails from ordinary pale nails. Here is why this should concern you. Research published in Cardiovascular Medicine has identified Terry's nails as significantly associated with coronary artery disease, heart failure, and diabetes. One study found that people with Terry's nails had an odds ratio of over 6 for coronary artery disease compared to people without them. That is not a minor statistical footnote. That is a major warning signal. And every one of the conditions linked to Terry's nails shares something in common. They develop slowly and silently over years before anything dramatic ever happens. If you hold your hand under good natural light right now and see an overall pale or frosted appearance across the nail with a thin reddish band at the very tip, that is what Terry's nails look like. Check both hands and do not dismiss what you see. But that is only sign number 1. The next sign divides the nail into 2 completely different colors, and the research behind it points to something just as serious. Sign number 2, Lindsay's nails. The second sign is called Lindsay's nails, sometimes referred to as half and half nails, and the name describes exactly what they look like. The nail is divided into two distinct zones. The half closest to your cuticle is white or very pale. The half closest to the tip is a brownish-red color. The dividing line between the two zones is usually quite sharp and clear, almost as though someone drew it on with a pen. Lindsay's nails have been associated in clinical research with heart failure and with liver cirrhosis. They tend to appear after the body has been under sustained circulatory stress for an extended period. The reason I'm covering both Terry's nails and Lindsay's nails early in this conversation is that they are both disorders of nail bed color that reflect how well blood is actually reaching and nourishing the smallest tissues in your body. When circulation to the fingertips is compromised over time, the nail bed loses its normal healthy pink color and starts producing these altered patterns instead. Both signs are visible in ordinary daylight without any special equipment. Hold your hand under natural light right now and look carefully at each nail. You can check for both of these in less than 30 seconds. Do it while the descriptions are still fresh in your mind. Now, the third sign is different. It does not change the overall color of the nail. Instead, it writes specific lines across it. And what those lines mean is backed by some of the strongest research we have covered so far. Sign number 3, Muehrcke's lines. The third sign is called Muehrcke's lines. These are multiple horizontal white lines that run across the nail parallel to the lunula, which is the small crescent shape at the base of your nail. Muehrcke's lines do not feel raised when you run your finger over them. You can see them clearly, but you cannot feel them with your fingertip. That detail is important because it helps distinguish them from other types of nail ridges. They are a visual signal, not a textural one. What makes Muehrcke's lines particularly significant is the research behind them. A study examining the relationship between nail findings and cardiovascular disease found that Muehrcke's lines were a statistically significant predictor of heart failure, with an odds ratio approaching 6. That means the presence of these lines made heart failure substantially more likely. The underlying reason is that Muehrcke's lines reflect low albumin levels in the blood, which is a marker of the body being under prolonged nutritional and circulatory stress. Albumin is a protein your liver produces, and when the heart is struggling to circulate blood efficiently, the liver feels the strain, albumin production drops, and the rest of the body starts to show it. Your nails are often the first place those consequences become visible. Look at your nails right now. If you see horizontal white lines running across the surface that you can see but cannot feel when you run a fingertip over them, those may be Muehrcke's lines, and they deserve a conversation with your doctor. But the next sign tells a completely different kind of story. Where these first 3 signs reflect chronic ongoing conditions, sign number 4 reveals something that already happened to your body, and you may not even know about it. Sign number 4, Beau's lines. The fourth sign is called Beau's lines. These are horizontal grooves or depressions that run across the nail plate, and unlike Muehrcke's lines, you can actually feel them. Run your fingertip across your nail. If there is a ridge or valley cutting across it like a small ditch, that is what a Beau's line feels like. Beau's lines appear because when the body undergoes a significant physiological shock, whether a heart attack, cardiac surgery, a severe infection, or any other major health crisis, the nail matrix briefly stops producing new nail tissue. When growth resumes, the pause leaves a groove behind in the nail, like a scar in the timeline of your nail's growth. What makes Beau's lines clinically important is that they can reveal a past cardiac event that you yourself may not have recognized. Silent heart attacks are far more common than most people realize, particularly in older adults. Research suggests that nearly half of all heart attacks in people over 65 produce no classic chest pain at all. The person feels exhausted or short of breath or unusually ill for a few days, and then it passes. They assume it was a virus. They move on. But the heart sustained real damage. Your body went through something significant. Your nails recorded it. And now, months later, the groove is sitting there waiting to be noticed. Because nails grow at roughly 3 to 4 millimeters per month, you can even estimate when the event happened. A groove that sits halfway up the nail likely corresponds to something that occurred roughly 2 to 3 months ago. A groove near the base is more recent. This is your body keeping a physical timeline of what it has been through, and it is remarkably accurate. If you feel a clear horizontal groove across your nail, particularly if it appears on multiple fingers, think back several months. Were you seriously ill? Did you have an episode that felt like a terrible flu? That groove may be your nail's way of telling you that something much more significant happened inside your body. Now, the fifth sign moves from the surface of the nail to underneath it, and what you see there can point to one of the most serious cardiac conditions of all. Sign number 5, splinter hemorrhages. The fifth sign is called splinter hemorrhages. They look exactly as the name suggests, like tiny dark splinters or thin dark lines running vertically beneath the nail. They are actually small collections of blood trapped in the capillaries of the nail bed. Now, a single splinter hemorrhage from bumping your hand against something is nothing to worry about. That happens to everyone. But multiple unexplained splinter hemorrhages appearing across several fingers at the same time is a different situation entirely. In medical training, unexplained splinter hemorrhages across multiple nails are classically associated with infective endocarditis, which is an infection of the inner lining of the heart's chambers and valves. This condition develops when bacteria enter the bloodstream and attach to damaged heart tissue. The infection causes tiny clots to break off and travel to distant blood vessels, including the very small ones beneath your nails. Infective endocarditis is a serious condition that requires urgent medical attention. If you see multiple thin, dark lines running vertically beneath several of your nails, and you have not injured those fingers, do not dismiss it. Mention it to your doctor as soon as you can. That conversation could catch something that is far more dangerous than it looks. If this information has been useful so far, take 1 second right now and tap the like button. It genuinely helps this video reach more people who need it. And stay with me, because the next 2 signs are the ones I want you to take the most seriously. The 6th sign involves a part of your nail most people think is purely cosmetic. And the 7th sign comes with a self-test you can do right now. Sign number 6. Lunula color changes. The small whitish crescent at the base of each nail is called the lunula. Most people think of it as decoration. It is actually the visible portion of your nail matrix, the active zone where new nail cells are being formed around the clock. And the color of your lunula is one of the most overlooked diagnostic signals on the entire human body. When that color changes, it is telling you something important. Researchers found that a reddish lunula is significantly associated with valvular heart disease and with congestive heart failure. A bluish or purplish lunula suggests problems with oxygen delivery in the circulation, similar to the cyanosis seen in more advanced cardiovascular disease. And a lunula that has faded to almost nothing, that has become very pale or nearly invisible, is often a sign of anemia. Anemia is directly connected to cardiovascular strain because an anemic heart has to work significantly harder to compensate for the reduced oxygen-carrying capacity of the blood. Here is what makes this sign easy to miss. These changes happen slowly. You look at your nails every single day, so you adjust to the new normal without ever realizing that something has shifted. That is why comparing to a photograph is so powerful, and I will come back to that in a moment. All 3 of these lunula color changes deserve medical attention. If the crescent at the base of your nail has turned red, blue, purple, or has nearly disappeared, bring it up with your doctor. And now sign number 7. This is the one I told you about at the very beginning, the one that shocks people. And unlike the other 6 signs, this one is not something you just look at. It is something you do. Sign number 7, the capillary refill test. The 7th sign is called the capillary refill test, and it directly measures how well your smallest blood vessels are functioning in real time. Here is how you do it. Hold your hand at the level of your heart. Use the thumb of your opposite hand to press firmly on one of your fingernails for about 2 seconds. You will see the nail bed go pale or white as the blood is pushed out. Then release the pressure and start counting quietly in your head. 1, 2. In a healthy adult with good circulation, the pink color returns to the nail bed in under 2 seconds. If it takes 3 seconds or longer, and you get the same slow result when you test 3 or 4 different fingers, that is a meaningful sign that your microvascular circulation is sluggish. Something is slowing the blood down before it reaches the smallest vessels in your body. Research has linked persistent slow capillary refill in older adults to reduced cardiac output, undiagnosed atrial fibrillation, and elevated stroke risk. Atrial fibrillation is one of the most common and dangerous causes of stroke in adults over 60, and it often produces no symptoms at all until a stroke actually happens. The heart is beating irregularly, blood is pooling and forming clots, and the person feels completely fine. That is what makes atrial fibrillation so dangerous, and that is why a simple test like this, something you can do in your own living room, carries real clinical weight. Try this test right now. Do it in a warm room with warm hands so that cold temperature does not distort the result. Press on the nail for 2 seconds, release, and count. Test at least 3 different fingers on each hand. If the color consistently takes 3 seconds or longer to return, call your doctor this week. Not next month, this week. That slow refill may be the only warning sign your body is giving you, and ignoring it is a risk you do not need to take. What to do next? Now let me give you a practical framework for what to do with everything you have just learned, because knowledge without action changes nothing. Start today. Take both hands to a window in good natural daylight. Look at each nail one at a time. Check the overall color of the nail bed for any whitish, frosted, or unusually pale appearance. Look at the tip of each nail for that narrow reddish band that signals Terry's nails. Check whether the nail is divided into 2 distinct color zones, white near the base, brownish near the tip. Look for horizontal white lines across the surface that you can see but cannot feel. Feel for any horizontal grooves or ridges that cut across the nail. Look for tiny, dark, vertical lines beneath the nail surface that you did not cause by injury. Examine the crescent at the base of each nail and notice whether its color has changed or whether it has nearly disappeared. Then do the capillary refill test on at least 3 fingers and count the seconds honestly. And here is the step that makes all the difference. Write down what you find. Better yet, take a photograph of both hands in natural light. These changes are slow and gradual, and human memory is unreliable over months and years. A single photograph taken today gives you something concrete and honest to compare against 6 months from now. You will be able to see changes that your daily glance would never catch. If you notice one of these signs, mention it at your next routine appointment. If you notice 2 or more of these signs together, do not wait for your annual checkup. Call your doctor's office this week. Describe what you have observed and ask whether you should be evaluated sooner. One more thing before I leave you today, and this is important. Do not use any of this to diagnose yourself. That is not your job, and it is not what this information is for. What these signs do is give you a specific, informed reason to start a conversation with your doctor. The full clinical picture, your history, your medications, your blood work, your other symptoms, that is what produces an accurate diagnosis. Your job is to notice. Your job is to document, and your job is to speak up. That is the part most people never do, and it is the part that makes all the difference. Your nails have been sitting at the end of your fingers your entire life. They have been recording what your blood is doing, what your heart is doing, and what your smallest blood vessels are doing every single day. The only thing that was missing was someone showing you how to read what they have been writing. You now have that. And I want you to understand how significant that is. Most people will go their entire lives without anyone teaching them this. You are no longer one of those people. From this moment forward, every time you look down at your hands, you have something most people do not. You have the ability to notice early, to act early, and to protect yourself before a crisis ever arrives. Tell me in the comments which of these 7 signs you are going to check for first tonight. Tell me what you found when you did the capillary refill test. Tell me your story, because this channel exists for you. I read every comment. I mean that sincerely. If you are not yet subscribed, do it right now. Every week I bring you evidence-based health information designed specifically for adults over 60 who want to take their health into their own hands. This community is growing because people like you share these videos with people they love, and I cannot overstate how much that matters. Share this video with someone you care about, because the next person who watches it might hold up their hand tonight, see something they have never noticed before, and make a phone call that saves their life. Until next time, stay watchful, stay informed, and never ignore what your body is quietly telling you.